I'm Andrew Vaughan. I'm a practicing cardiologist. Currently, I'm on faculty at Marshall University in Huntington, West Virginia, but I've practiced in every kind of setting. 25 years private practice, initially out of fellowship, then 10 years at the VA, which got me into the university system, and finally left the VA to go downtown, and I've been there for the last 8 years. So I'm approaching my 40th year of practice in cardiology. To me, culinary medicine means how to talk to patients. As training in a cardiology fellowship and through my early years of practice, well, my advice was, eat a heart healthy diet. Well, what does that mean? I didn't know that. I mean, we didn't get education in any kind of nutrition through my residency or fellowship or even afterwards until 2015 when I heard about this conference, Health Meets Food, in New Orleans. I said, really? We're bringing together people who are in food and people who are in medicine and actually going to talk about how those two work together? And it changed my life. It changed my practice. And I was able to begin to understand the language of food. And that's what I tell my med students in the elective that I teach. I'm not here to teach you to be a dietitian or a nutritionist. I'm here to help you understand the language of food so you can talk to your patients when you get into practice. For my patients, the practice of culinary medicine, although I don't teach community courses, I have been able to incorporate the idea of taking a rapid dietary history to find out where the points are that can be addressed by a referral to my dietitian. I think that is so important because if they hear that information from me, that I think it's important, then they're more likely actually to show up to the consultation with the dietitian and actually have that important hour of detailed discussion about what they need to do with their diet. If a colleague came to me and said, I've heard this thing about culinary medicine, what do you think about it? And I said, let me tell you about this conference, and this is where you need to go to get involved, and here's the website, and I can give you some other information if you like, but I would strongly encourage you, if you've even thought about any way to talk to your patients about nutrition, this is the place to go. I mean, the idea of culinary medicine is important for patients because I think it gets this level between the doctor or the provider and the patient to an even playing field, because I can understand their position and where they are, and then they actually have somebody who can talk to them about their diet, their food, their lifestyle, and I incorporate all that in my history. Well, for my healthcare team, the culinary medicine practice really began with collaboration with the Department of Dietetics at the university. And that was the hook to get my elective through the curriculum committee, interprofessional education. And that was such a key because that box needs to be checked. And I just walked into the chief of dietetics office one day and told her who I was, and I thought we ought to be able to partner together. She's like, who is this guy? and that's it. I mean, we've done, 10, 12 semesters of elective now. So it's been great fun. I have great friends in the Department of Dietetics, and we really enjoy doing it. And we have a wonderful teaching kitchen at our campus. My favorite ingredient, and it's not one because there's a dozen, of the fresh herbs that we grow on our back porch in every season, and they're coming into season right now, but basil, oregano, thyme, chives, cilantro, all of that. And it's having those fresh herbs through the season to add to cooking at home is just a real treat.